I guess one of the key challenges is we all feel we're being fair, but it's making sure that we are actually being fair. I mean, one of the issues that came up this morning was about widening participation into medicine. I'm the Dean of the Faculty of Medicine in Southampton, and we have a widening access programme that brings in individuals from backgrounds who wouldn't normally apply to do medicine. But part of the issue there is how do you raise that ambition in children and in their school teachers so that they come forward to apply to medical schools in the first place. So being fair to the whole of society, to create a medical profession that is more in keeping and in touch with society requires that kind of change. And the challenge is going to be how do we get the message out so that people do apply to medical schools. Once they apply, there's a fair process that will allow them to apply.
I think it's about attending to the needs of the people who might think the process is going to be unfair to them. So what I'm going to go and do is maybe canvass some ideas from doctors whose tradition have difficulties around the phrases, make sure I understand what the challenges are, what the fears are, and make sure that I'm interpreting the kind of GMC or RST recommendations as fairly as I can to all the groups, including DNA groups, in a way that I can say my organisation will do everything according to the book and to everybody as fairly as I can.
I was really interested by the discussion about the increasing numbers of women that are coming into the profession and the insistence that we can't just describe that as a problem, that it would be wrong to describe that as a problem, but to start thinking about what that means for the profession, I think is really important.
I think the key challenge is confidence and communication with doctors. They need to feel reassured that the GMC is not there to beat them with a stick and that they are there to protect patients, but obviously to also ensure the integrity of the profession. So I think it's communication, really putting the message out there that the GMC is trying to work with doctors to improve the profession.
It's probably all the different people from different areas working together with a common goal. So we have folk not just from medical schools in the GMC, but from the profession, from people who are sort of consumers of healthcare as well. And it's realising that there is something we'd all like to address and working together to find a solution that hopefully will help all. And the key thing, improve patient care.
One of the opportunities in talking about education, which is the workshop that I chaired, is to acknowledge that there really is an appetite for engaging on matters of selection and training, that these are really complex matters, and so the challenge is to not be put off by the complexity, but to really now move forward on it.
What the GMC have sort of seized on. I think there's a lot going on with revalidation. It's going to be a critical next step, I think, for the whole profession. So I think timing is really important. So this is the opportunity.
Opportunity, I think, to spread the word that the GMC is not actually trying to make life difficult for doctors, but is trying to have this balancing act between protecting patients and making sure that the public has confidence in doctors. And I liked the discussion about the less adversarial way of dealing with some of the complaints that came in.
I think for the GMC the key challenge is to, now that we've started this engagement with really important partners on ensuring that processes and systems, whether it's education or fitness practice, all these things, now that we've started this discussion, we have to keep it going. This can't be just the conference and that's the end of it. We have to really now continue this debate.
I think I'll take away the message about the GMC wanting to hear people's views and wanting to help and having more supportive role with employers.
Today has provided a wealth of opinion, and what we really need to do is take away all the things we've learned today and really put them into practice in the places we work in. Because we talk about fairness and we talk about equality and we talk about the GMC leading on that and being shown to be fair and being shown to treat people equally, but we have to do that ourselves in the workplace, on the ground, with our colleagues, with our employees and with our employers.